Rose.
Hi.
And I work with Dr. Bonham. I'm attending. And we're just going to talk to you a little bit about the process of listing from our standpoint, from the surgical standpoint, surgery.
What's a fellow mean?
So I'm in training.
Okay.
But I'm actually 1 month away from graduation.
Oh,
yes.
Congratulations.
So
That's if he passes it.
If he passes. He may not. So no, but I'll be attending soon. And then also just to reconfirm some of the information that we've already heard about Jackson coming in from the hepatologist. I believe you met Dr. Lou Brandon
Yes.
from hepatology. We all work together as part of the team.
Okay.
So I understand Jackson's now 3 months old. And born with biliary atresia, pardon me, sorry. He's about 5.5 kilos now, and he is starting to gain weight at the moment.
I guess from the ER to one day, 1 pound.
That's pretty good. Okay,
Yeah.
and it's not fluid in his belly, or
Probably.
okay.
I can't see how it's not that. We didn't give him his medicine. So what happened was we didn't give him his nighttime medicine because we got distracted. And he didn't get his medication until 1 in the afternoon, and I wasn't going to wake up at 1 in the morning and give it to him, and I should have, but then it would throw it off today, and I didn't want that to happen, and so he has any bowel movements.
Okay. So we actually just came from our pathology conference, and we saw Jackson's biopsy pathology, and one reassuring thing that we saw was that there was no evidence of cirrhosis of the liver. So that's the end stage part of a lot of liver injury from the biliary atresia. But the pathology was consistent with biliary atresia, which we already knew. And he had his Kasai at, what was it?
He was
1
a
month.
month old, so it was about March 31st, I believe.
Okay.
He had it, or March 27th, something like that. I can't remember exactly.
Did his jaundice ever clear after the Kasai? Never.
Never.
Did the stools ever get dark?
Never.
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 And
But they
I
were
assume they
bringing-
gave you a course of antibiotics after the Kasai as well to see if that.
They didn't tell me to bring that. No. They had we had the antibiotics there at the hospital, but he didn't send us home with any. He chose not to.
And he hasn't been readmitted at all since
no.
his Kasai? Okay.
No. They said when they, I remember Albert Chong said that his liver looked damaged, but you know, that was it. When he told me how it looked.
Right. So clearly it's not cirrhotic. It just has some scarring in it.
Right.
When you get to the point of cirrhosis, the scarring is so severe the liver can no longer regenerate. And everybody's liver is always regenerating every day because the liver is what gets rid of all the toxins in your body.
Okay.
And so you don't develop liver failure until you lose so much of the liver that it can't do that anymore.
Right.
Now, when you have some ongoing injuries such as hepatitis or alcohol, or in his case, biliary atresia, you eventually get so much scar formation that the liver can no longer regenerate. And that's when you have what we call cirrhotic liver. And after it's cirrhotic, with the ongoing damage and loss that happens to the liver every day, eventually you get to the point where you don't have enough liver cells anymore to do what they need to do.
Okay.
And that's when you have the end-stage liver disease. It's manifested by a number of symptoms. Now, he doesn't have cirrhosis now, but since he hasn't cleared his jaundice and he hasn't had normal colored stools, that indicates that the Kasai has not worked very well. And that happens about 20 to 30% of the time. It just doesn't work well.
Right.
So he's going to have a more rapid progression of his course than, say, a kid who has a very successful Kasai, whose bilirubin returns to normal, who has normal colored stools, normal colored urine. So some of those kids can go years and years and not need a transplant until they're a teenager or even in their 20s.
Right.
But a kid who doesn't have a successful Kasai will progress considerably more rapidly to where we're talking within a period of months or a year or two, you've damaged the liver to the point that they need a transplant.
Is it true that I read that most kids with biliary atresia don't live past 2?
No. Well, if it was never treated,
Yeah, if it's not
if it was
treated.
never treated, if you didn't have a Kasai, if
Right.
you didn't have a transplant, yes, that's
Okay.
correct.
Okay.
But I can't imagine a child in this country having biliary atresia and having nothing done.
Oh
Yeah.
no,
Yeah.
absolutely, no.
I mean, I guess that could happen in some other countries, but that just doesn't happen. So,
Whoops. How long do you think you guys would wait with him?
well, we will wait until he gets sicker. So, the indications for transplant would be either...
There's the baby.
Oh, he's a Giants fan.
Super cute. He's
so cute.
So,
Here's the baby.
so when he develops signs of liver failure, so the signs of liver failure would be ascites, so fluid in the belly,
Right.
especially that we can't control medically, so you're having to bring him in and they put a needle in to drain the fluid out.
So we have to wait till that starts
Well,
happening.
no, there are several indications. Encephalopathy, where the ammonia goes up, so he becomes very irritable and even to the point where he's comatose, he can't bring him to the hospital. Refractory infections, cholangitis, so it doesn't sound like that's been an issue with you, but there have been kids after decided they keep coming in the hospital every month with bad infections.
Okay.
Growth failure. So, despite adequate nutrition, he can't gain weight, he loses muscle mass. Kids that are a little bit older, you'll see them developmentally, they're not progressing. If a kid was going to school, they drop out of school. Obviously, before we say a kid has growth failure due to the liver, we want to optimize their nutrition. Changing formulas around, sometimes we put in a feeding tube, sometimes we can even give them stuff IV. And that may be enough to turn them around. This is the first time we've seen him. But it sounds like he hasn't had problems with fluid that we've had to tap out. He hasn't had problems with
You haven't had to
encephalopathy.
take it out, no.
Right.
You
Just
treated
with a
it by
pill.
medication,
Yeah.
yeah.
Yeah, and that's fine. He doesn't look malnourished, and it sounds like he's starting to gain some weight. So I think we have time to tweak around the nutrition a bit.
Okay.
We've transplanted very tiny kids. I think the smallest I've done is a 4-kilo kid.
Oh, wow.
But our results are better once you get over 8 kilos. That's kind of the cutoff where you get them above 8 kilos, they do better. And that's for a couple of reasons. Number one, when they're so tiny, it's technically very challenging. You're working with these tiny little blood vessels and bile ducts. And the smaller it is, the higher the risk of something clotting off.
Right.
But the other reason is if you're transplanting a kid, the